So my friend Tom shared this article in our autism group, and this is highly concerning. Even how this is worded, switch off autism symptoms. And they call it a breakthrough discovery. They are so out of their right minds. And they still make it about socializing. A team of experts at Germany's Hector Institute for Translational Brain Research found that the medication lamotrigine, an anti-seizure drug, was able to curb behavioral and social problems linked to the disorder. It's not a disorder. Jesus. And now it's being hyped as a potential cure for humans. So you want to cure humans from what? Apparently, drug treatment in adulthood can alleviate brain cell dysfunction and thus counteract the behavioral abnormalities typical of autism. They still make it about behavior. It's not about behavior. It's about reacting to stressors due to sensory overload. You idiots. Jesus, this is so backwards. So, lamotrigine, which is sold under the brand name Lamictal among others, is a medication used to treat epilepsy and stabilize mood in those who suffer from bipolar disorder. Bipolar disorder, this is manic and depression as far as I know, which is nothing like autism, which is sensory overload due to sensory sensitivities to the environment. Reversing changes to brain cells caused by genetic mutation. It's not proven that it is genetic. They never found autism genes, you fucking morons. This is a waste of money. Scientists have spent years intensely searching for the molecular abnormalities that contribute to ASD. Gosh. So I have looked up the side effects of this lamotrigine or Lamictal. So this is by the Mayo Clinic, okay? Side effects of lamotrigine. Along with its needed effects, a medicine may cause some unwanted effects, although not all of these side effects may occur. If they do occur, they may need medical attention. So you need more medication to treat all those side effects. This is nuts. So side effects: blurred vision, changes in vision, chest pain, discomfort or tightness, clumsiness or unsteadiness, decreased urine output, dilated neck veins, double vision. Irregular breathing, irregular heartbeat, nausea, pain or discomfort in the arms, jaw, back or neck, poor coordination, seizure that will not stop, skin rash, sweating, swelling of the face, fingers, feet or lower legs, trouble breathing, unusual tiredness or weakness, vomiting, weight gain. and less common anxiety. We all know many autistics have anxiety due to stress in their environment. So more anxiety. How is that a good solution? Chest pain, confusion, continuous uncontrolled back and forth or rolling eye movements. Depression, increase in seizures, infection, irritability. So how is that supposed to be a solution? Rare, blistering, peeling or loosening of the skin. What? Chills, cough, dark urine, diarrhea, fever, general feeling of discomfort or illness, headache, itching, joint pain, loss of appetite, memory loss, muscle cramps, pain or weakness, red or irritated eyes, runny nose, shivering, small red or purple spots on the skin, sore throat, sores, ulcers, or white spots on the lips or in the mouth, swelling of the face, mouth, hands or feet, swollen lymph nodes, trouble sleeping, unusual bleeding or bruising, yellow eyes or skin. This is connected to probably liver dysfunction. How is this drug even approved? Incidents not known. I don't know what that means, but it's still listed, so I read it. Back, leg or stomach pains, bleeding gums, bloating, blood in the urine, bloody black or tarry stools, bluish lips or skin, constipation, cough, coughing or vomiting blood, difficulty with swallowing, fainting, fast heartbeat, general body swelling, heartburn, high fever, hoarseness, lightheadedness, loss of balance, control, lower back or side pain, mask-like face, muscle spasms, nosebleeds, not breathing. Wow, what an improvement. Just kill off autism. Pain or burning in the throat, painful or difficult urination, pains in the stomach or side, possibly radiating to the back. Pale skin, persistent bleeding or oozing from puncture sites, mouth or nose. Rapid, shallow breathing. Redness, soreness or itching skin. Shuffling walk, slowed movement, slurred speech, sores, welting or blisters, stiffness of the arms and legs, swollen or painful glands, tick-like jerky movements. Symptoms of overdose. We all know that autistics react to medication with a heightened sensitivity. So this is a real danger here. Clumsiness or unsteadiness severe. Continuous uncontrolled back and forth or rolling eye movements severe. Dizziness severe. Drowsiness severe. Dryness of the mouth severe. Headache severe. Increased heart rate. Loss of consciousness, slurred speech, severe. Wow, what an improvement of quality of life. But just kill off the autism, right? Doesn't matter, you have all those fucking side effects. Meanwhile, clinical human trials studying lamotrigine's impact on MYT1L are being planned. And while the research is currently limited to mice, the results are promising, researchers stressed. promising results. So one comment says, I work with people who have autism that are already prescribed a lamictal, and it doesn't appear to do what is being described here at all. And another comment says, my son with autism started on this drug at 15 for new onset seizures. I did not see any change. It also increased his insomnia. Side effects not mentioned here. And increased his seizures. We didn't stay long on it. 2 months at full dose. And another comment says, this can't be a meaningful idea. This is an ordinary old medication. I have autism and I took lamotrigine for 2 years for depression. Oh my gosh, 2 years. And it made no difference to my autism. And another comment says, ditto. The increase in autism diagnosis can also be partly due to greater awareness by some pediatricians to the more subtle symptoms, or by broadening the spectrum to a hammer everything looks like a nail, whatever that means. And finally, one comment says autism isn't something that needs to be cured. Most autistic people are just as smart, if not smarter, than non-autistic people. There are plenty of people who identify with high-functioning autistic spectrum and would be reluctant to change their situation. That's fine. We don't need to cure quirky or weird. But still, find the medication that works for severe autism. Still being looked at as a disease or a disorder. It just shows that so many people are not educated about autism at all. Again, it's about sensory sensitivity and reacting to stressors in the environment. And no medication will ever change that. Shyness. Friend of mine's son was diagnosed on spectrum while we all thought he was normal, but to introvert side. I see pharma corporations want to square all kids are smiley and obedient. No more personalities and traits. Yes. And lamictal also causes the Stevens-Johnson syndrome, or a chemical burn in susceptible individuals. It's a tricky medication used as one of the last resorts in treating epilepsy. This is offensive. I agree. Autistic people do not need to be cured or have parts of ourselves switched off. We are just people whose brains work differently than most. Maybe address and fix your discomfort about people who are different instead of trying to fix them.